I say it right?
Yes.
Welcome to the IHS and to the International Headache Congress in Seoul, Korea. It's my pleasure to have you. You are one of the first nurses that are dedicated and doing education and patient care in headache that I have met. You are from Norway, and you're heading a world effort to empower and to involve nurses in headache care.
Yes.
Have I gotten this right?
Yes, and an important thing is I'm also one of the board members in the International Forum for Headache Nurses. And
wow.
We had a session yesterday.
Yes.
Where I was one of the speakers here at the conference.
And it was a very good session.
Yes.
I know that there's more interest from nurses now, and you are leading the world into helping more nurses get the education, but also get involved in the bigger picture with IHS and with bigger organizations that manage headache, and to involve nurses in headache.
Yes.
Okay. I want to know more about you. Who are you?
I'm Gøril from Norway, working at Advisory Unit on Headaches in Norway, and also a part of Norhead, newly started getting funded for doing headache research. But I've been working with headache and headache research for 20 years already, and I've been working with Tim Steiner and being part of the global burden, not the global burden, but the global campaign against headache. Yes, yeah. And I was actually the nurse that collected all the data for the headache atlas of headache disorders and resources in the world that was published by WHO and lifting the burden.
What an amazing achievement.
Yes.
I'm honored to have you today, and also very impressed with 20 years. I haven't been 20 years in headache, but already I know that nurses are very, very important in managing headache. Yes. And I think they might solve for the big shortage that we have in headache specialists and neurologists specializing in headache. What made you want to do headache?
A little bit of coincidence. It was an opening position then 20 years ago, where Lars Jakob Stovner, my previous boss,
of course,
he's retired now. Yes. So I had background in neurology before that, and it was a coincidence, but I loved it since, and I think it's wonderful all the work we have done, but it takes time. I wish it gone faster, but now I'm happy that we have gotten so many new colleagues, nationally and internationally. So it's becoming more and more nurses in the headache field, because they understand that we need nurses to actually help, because there are not enough healthcare providers to help people with headache, and all the emphasis on headache worldwide. Yeah.
I think there's a shortage of specialists, but also there's an amazing role. Nurses are more patient, they are more, they have more time, and they're closer to patients. Is the relationship different between a specialist and a patient versus a nurse and a patient? What do you feel about this?
I think that's difficult to say. I think it's actually lacking the expertise in primary care, the lowest. So people don't get the diagnosis, they don't get help for their headaches. But I think when you get to see the specialist, you see the nurse. But I think all of us need more information and more education, more knowledge about headache to actually help the broader part of the public, I would say. So I think, we are so specialized, so I don't think they get more help or more time with nurses these days. I think, you know what I mean? Or is it, we don't have more time than the doctors now. We are sort of told
you're
that
also told
you're told, don't use more time. You need to, yes. And we are trying, I think, also that the doctors don't want the nurses to spend twice as much time with the patient, because, of course, then you prefer the nurse. I think they really want you to do the job in that, that 30 minutes, that the doctors don't get more than 30 minutes or 45 minutes, then the nurses shouldn't either. So I think we're trying to...
But I feel that you can do more in terms of counseling, supporting,
yes.
And the specialist cannot see everybody, but
No.
we have many more nurses that are interested now in headache, that they can do more, that they can do more than just the, as you said, I hate the slot. I hate the minute slot. I feel I need to give as much time as the patient wants, but we are also limited with time. But in that 30 minutes that you have with a patient, what is the part that you feel has the highest impact on patient care, on headache care?
I think just giving good enough information for the patient to actually do an informed opinion themselves. You know, I want to give you all the knowledge. This is the non-medical treatment, this is the medical treatment, and this is what we can do, and this is what you have to do on your own. And I think giving them enough information, realistic information about their situation, so they can make good choices for themselves. I think that's my main goal. Talking to a lot of people, giving them, this is, right now, this is what your choices are and what's the best choice for you.
Okay. And in Norway, help me to understand, are nurses able to prescribe?
No.
So even, do you have nurses and nurse practitioners? Do you have different?
No, we have just nurses, that one, yes.
Okay. And do you feel that this needs to evolve so that nurses are able to prescribe as well? Do you feel that this will help people living with migraine and other conditions, or?
I don't know, because it depends where you work. You know, I work at the specialized center, you know, and they're already referred.
So they will anyway see a specialist.
Yes,
they will not stop at your visit.
No,
so
it's more, I'll do the follow-up, I'll do the management afterwards, and I work a lot with research, you know, so and people contacting me to get answers on their own behalf. Have I gotten the best treatment where I live? So I can sort of, a lot of information, education, that's what I do, same as you, education. Information for them to make choices and then see the right doctor to
actually get the right treatment.
Yeah.
So you research, tell us about the research that you're involved in.
My main research these days is a huge study on candesartan, just to get, you know, we have more than 500 patients in that study, just to get the final knowledge, to get this reimbursed, to get this in the insurance, to get them in the European guidelines. Yes, so that's the goal. So this is a huge research project with 9 hospitals in Norway and 1 in Estonia. So that's the main. The goal is to actually get it in the European guidelines or the international guidelines for candesartan, to move it up. If it's good enough, yes.
So how many patients are you recruiting?
500.
Okay, and that is across how many centers? You said 9 plus 1?
In Norway,
so 10, a total of 10.
Yes.
And I love candesartan myself. I know that the first idea with candesartan actually came from Norway.
Yes, it did. Yes.
And I was told today, I was having a conversation and someone told me that the first presentation around the world came from
my headache center.
From your headache center to say, this is a solution that actually works. And like, how did this come? How did you find this out?
It was one of the doctors, and he got high blood pressure when he was 42, and then he started with a different drug, but then his migraine disappeared, and then he had patients in the outpatient clinic, and he couldn't help them. He had tried everything, and then he said, "Oh, you can try mine." And then the first 3 had really good effect. And then he researched mine, and he said, "This I need to investigate." So he then made an application for the ethics committee to do this research, getting funding to do, and then he tested it out. But that particular drug, had some side effects that he didn't like, because you changed from migraine to coughs, and then that wasn't helpful. So then he thought of the content of candesartan, and then he made another study.
So it was by coincidence and to personal experience.
Yes. And then, of course, he just didn't continue prescribing his own medication. He thought, I need to investigate. So half of them placebo, half of them actual drug, without knowing, and double blind and all those things. So he did a really, good study to actually document what.
And he changed our practice.
Yes,
I mean,
yes.
I use it with my patients. I feel it's underused in the guidelines. It's not high up for me to say.
But that's because they don't. We haven't we don't have the research to actually support it higher up. That's what we're doing now.
And when will you get the results of this?
I think we have already recruited almost all the patients, so it will be done in a year or so, I guess.
So next IHC, I might see.
I'm not sure, because the statistics and all those things, and it takes a little bit. But we're still including, and we will be including patients until Christmas this year, I think. Yes.
IHC in Seoul, have you seen something that you think will change your practice, or something that was very impressive for you, or a new idea?
I've been to several of the presentations, but I think just meeting people, getting to know people, and I think that's, networking is more information for me, because I think I like the hands-on information. So I went to the vascular disease.
Me too.
Yes, but the thing is, I didn't find anything there that typically I can use in my work. But then I met a colleague, and he just, this was really good, very interesting. I really liked it. So that's a good. We're discussing it afterwards.
How? And it's exactly the same. I sat next to someone, and after we left, he was like, "In my practice, I do this." And then that lecture came to practice to me instead of it being the lecture I saw. That discussion with my colleague made me think, when I go back, I need to think of this and that.
Exactly.
We have the same experience.
Yes, because right there and then I sort of, I can't use any of this in my daily practice. But then afterwards discussing it was.
It was. Yeah. And what is your dream research? If you could do any research in the world, what would you like to investigate, personally? If I gave you all the money you want and said, do a research, what do you want to answer? What question do you want to answer?
I think that's a difficult one. But I like the global campaign against headache. I like thinking of all the people all over the world. I want it to be fair. I don't want very few people getting the expertise, the best in the world. I'm happy for them to get that as well, but I like the broader concept. So for instance, getting triptans available for more people around the world, instead of just that 1% that actually have access to triptans. I find that really...
After 30 years of introduction.
Horrible. I find it awful that it's not available, and it's too costly in many countries. And I think that's... If there's something I would like to do, is just made things that really work accessible for more people.
And I think we're doing this with lifting the burden and looking at these global data to say, look, it's not fair today. No. But there are also options. You said triptans. For me, we saw yesterday only 20% of people who need a preventive around the world. Yes. Not only in the developed, underdeveloped, or whatever,
and
all over the world.
Overuse. Medication overuse headache.
And medication overuse, an easy thing to solve, but we still see it. But only because we're not treating these patients. It's not really the patient taking too much. We're not giving them options that actually work.
And they don't know. And they don't know that this is the cause, or it can be a cause of their headaches. And I think knowledge, education, that would be some kind of education to make it information available for all. I think that would be wonderful, something like that. That's
and the next IHC is going to be in Sao Paulo in Brazil. I'm hoping we meet again there, hopefully. What would you like to see?
In Brazil?
Other than the beautiful Brazil. I mean, I'm so excited about the location.
I think it's so...
Anything that you feel that you would like the IHS to include in the program? I
want to have a session for nurses.
Yes.
And as we have here in Seoul. I think that's very important, because there are nurses from the UK, nurses from Norway, and we got to meet them, and the nurse from Japan, and there are only 10 nurses in Japan.
That actually do
headache nurses, yes. Less than 10 nurses in the whole of Japan. So they're in the starting point of building up their headache clinics to include nurses. And I think I would love a session with nurses from South America.
From more nurses that are interested. I think you're leading the way in inspiring more nurses, and the more nurses that hear about this. I know I have talked to a nurse in Canada who is still in nursing school, and she said, can you introduce me? I want to meet this inspiring nurse. So it's not something that will happen overnight, for sure. We have 2 years maybe to recruit more nurses to come.
And we do recruit all the time, and I think it's building up. It's getting better, but we need information. We need to be part of the
bigger.
Yes. So they know us, and we do have a website. We do have everything, but it takes time. It takes time for people to find out.
You've already broken a lot of walls. You've already broken into an area nobody was there. So I have faith that next time when we meet at the next one, that we will see many more. And I'm looking forward to seeing you again. It has been my pleasure to have you. This has been amazing, and thank you for sharing your experience and your journey with me.
Thank you for having me.